So one thing with COVID, there's been a lot of talk about those who actually got hospitalized.
Yeah.
And in regards to like them having serious underlying issues.
Yeah.
Was that the case for majority of your patients that you ended up dealing with?
So when they say underlying issues, the problem is most of the underlying issues was just high blood pressure, which is not a serious. I mean, if it's not a serious thing, I'm sure any black person will know their parents, friends, their aunts and uncles who all have high blood pressure. Most of the patients, that was the only underlying issue they had. Some of them diabetes, but most of them were just high blood pressure. So I would say it was mostly obesity that I noticed.
Yeah.
Obesity and unfortunately
That's what I heard
being
a lot
black,
about as well.
being black and being Asian were probably the biggest risk factors.
Yeah.
Yeah.
I mean, there was a lot of talk about like the BAME
Yeah.
community and having like disproportionate
Yeah.
deaths as well. So was that down? What would you bring that down to? Because there's been a lot of debates and a lot of like articles that I've read
Yeah.
in relations to this. So on one hand, there's the argument that it's a cultural thing
Yeah.
in regards to what we eat, our lifestyles,
Yeah.
the amount of individuals that live within a household.
Yeah.
And then also on the other side, there's the prejudice argument.
Yeah.
That there's some level of like lack of care towards like the BAME community. Where do you think it tilts to, or is there a combination of both?
I think
that
it's a
causes it?
combination of multiple factors. So an example is my ICU. At one point, we had 21 patients downstairs. We had 2 ICUs. And I counted one day and there were only 2 white patients on ventilators. So even if you said the area was mostly
More
BAME,
harassing us, yeah, but
oh goodness, it was mostly BAME. That was
Yeah.
disproportionate to the number of people in the area.
Yeah.
And it's a few factors. Number one, it's economical. So most black and ethnic minorities are likely to work in low skilled jobs,
Yeah.
which means they're more likely to be key workers. They're more likely to be the one who are working in supermarkets or be the security guards or, you know, that sort of stuff. So you're more likely to be exposed. If you go into any London hospital, most of the nurses are either black or Filipino.
yeah.
And that's just what it's like in London. So that's one thing. And then if you are economically disadvantaged, you are more likely to make poor health decisions. You're more likely to eat badly. You're more likely to be overweight, which then puts you at risk of certain conditions like diabetes and hypertension that are the risk factors for getting COVID. So for me personally, when it all boils down to being an economical problem.
Yeah.
All right. So that's one. And then secondly, it's the cultural thing that you mentioned as well. But when you think about it, especially in the black community, there really isn't that thing where loads of people live in the same house.
That was more towards like the
Yeah.
Asian community, I think,
Exactly.
when the research came out.
But even a lot of the Asian communities, the slightly younger ones, that doesn't really happen. But again, you're more likely to work in low skilled jobs. So things like Uber drivers, taxi drivers, bus drivers. And unless the economical side and the economical disadvantage that black and ethnic minorities suffer is addressed, I don't think anything will ever be solved.
Yeah.
And I think all COVID did was highlight that black people and ethnic minorities in the UK are at a economic disadvantage compared to our white counterparts.
Yeah. Yeah, so to me, it comes across like it's a long-standing economical issue. So it wasn't just like immediately caused by COVID. It's a result of
I don't think anything was caused by COVID.
Yeah.
I think all COVID did was highlight the economical disadvantages and the health inequalities that have always existed.
Yeah.
All COVID did was brought it to light.
Do you think the racial inequality side as well comes into it in regards to like... So a lot of people complained that there wasn't like immediate action taken when we first discovered what was causing COVID and also the individuals who were most likely susceptible to COVID.
Yeah.
So how do you think the response was in regards to that? Were the people given it adequate protection, or was it lacking simply because of the race of these individuals?
I think...
Because I know it's a tricky one.
Yeah.
Because it then questions everything. It questions government decisions.
I think
it questions policies.
from the very get-go, the government policies and government decision-making was very, very slow.
Yeah.
And it wasn't until a lot later, when it was too late, did we notice that actually a certain group of people are more risk as well. But I think generally the response was very slow. And what needs to happen now is addressing those health inequalities, because all COVID has done is highlight those health inequalities. There wasn't as much time to do anything about it at that time. But now that we know that these health inequalities exist, then we can do something about it for if we do have a second wave, if we do have a third wave.